name is Logan Griffin, and I'm going to talk to you about STDs and their prevention. So, a little background information is that STDs, as everybody should know, stands for sexually transmitted diseases, and you can get them from having any type of sexual contact with another individual. Doesn't matter if it's man to woman, man to man, or woman to woman. You can still catch an STD if you don't use protection. A lot of the STDs include HIV and AIDS, chlamydia, gonorrhea, HPV, warts, and syphilis, and there's more. So I'm going to ask a question. How many people a year do you think get the STD? You can raise your hands. I guess I remember.
Say your question again and clearly.
How many people a year do you think get an STD a year?
Millions.
Yeah, but how many? How many?
About 2.5 to 3 million people a year.
Okay. Anybody else? So about 19 million people a year get an STD, and that's just, I guess, the recorded number. And you know, some people don't go and get checked, so the number could actually be higher. So basically, STDs is spread through, you know, bodily fluids, blood, vaginal secretion, semen, and like for HIV, breast milk for women. The article that I guess I looked at was basically called pregnancy. It was about pregnancy and couples like protecting themselves, because you know, even if a couple has sex and I guess one stepped out of the relationship, had sex with somebody, and the partner got pregnant, through the pregnancy the baby can contract the STD. So basically what we wanted to look at was preventing the STDs, and the best way to not get an STD is to not have sex at all. But if you do have sex, it's best to be in a monogamous relationship, limit your sex partners, use condoms. Yeah, so I have 3 videos that I want to show. The first one is about gonorrhea, because a lot of people know that the STDs that are not curable are usually the ones that begin with an H, so like HPV, HIV, herpes, things like that. Those are incurable, but usually people think that gonorrhea, chlamydia, and syphilis, things like that are curable. But in recent studies this year, they're finding out that gonorrhea is becoming incurable, so you might want to be careful. Can y'all hear? That's as high as it was, I'm sorry.
Scientists reported last year that a case of a strain of gonorrhea in Japan in 2008 that was resistant to all recommended antibiotics, and reported then that it transformed a once easily treatable infection into a global health threat. The UN Health Agency said Wednesday that millions of patients were contracting nonsense, less doctors had to treat cases earlier. Countries including Norway, Sweden, Britain, France, and Australia are now reporting cases of STD-resistant antibiotics. If left untreated, gonorrhea can lead to common inflammatory disease, ectopic pregnancy, stillbirth, severe eye infections in babies, and infertility in both men and women. Gonorrhea is one of the most common STDs in the world, and is most prevalent in Southeast Asia and Sub-Saharan Africa. According to the Centers for Disease Control and Prevention, the number of cases in the U.S. is estimated at around 700,000 per year. First question, how many times?
Okay, so if y'all could hear, she was basically just talking about how around the world a lot of people are becoming infected with the incurable strain of gonorrhea, and it's antibiotic resistant. So the next video I'm going to show is basically just talking about condom use.
Condoms are incredibly effective in preventing the transmission of STIs and STDs. They're a great barrier method. They protect you skin to skin. They protect the transmission of infectious fluid. Although no method is 100% effective, this is the best protection that you can know a condom has not been pre-opened or compromised in some way is that you'll have an air bubble. Condoms will be able to actually feel air in the condom or resistance. If the condom has actually been opened in some way, you won't be able to feel air bubble. Most condoms have a serrated edge where they join together, and that provides you a really great way to open them. You want to push the condom to the side. Try not to use your teeth because that can actually rip the condom. Just use your fingers. You open the condom up, and you take it. When you take the condom out of the package, you'll notice that it's rolled up, and there's a correct and incorrect way to roll the condom down. The correct way is that the rim is on the outside of the condom, and we always say that it kind of looks like you have a little hat. When you have the rim on the inside, it looks a little bit more like a bean. If you start to put the condom on the wrong way, and you find out that it's the wrong way, you should throw the condom away and start with a new one, because what's happened is you have potentially infectious fluid that was on the inside of the condom that now will be on the outside of the condom, and that's not a good thing. So once you determine that your condom rim is on the outside, you want to pinch the top of the condom so that the ejaculate has some place to go. If it doesn't have a place to go, it can push the condom off the penis, or it can cause the condom possibly to rip or tear. So you want to leave room at the top. You have the rim on the outside. You roll the condom all the way down the shaft, not the shaft of the penis, all the way to the end. You want to make sure that it's nice and snug on the end, but that there's room at the top of the condom so that the ejaculate is somewhere to go. And then you do whatever you normally do with your penis.
Normally do.
Bottom of the condom, and you withdraw it gently. Take the condom off, and you just twist it and throw it somewhere that you don't have to be in touch with the fluid, that doesn't get down. Please do not flush it down the toilet, actually clogs drains. So when you're done with the condom, you're done. It's a one-use only item. You throw it out, and it's gone. If you're going to start another activity that requires a latex barrier, you get a brand new condom. So that's sort of basic how to use a condom.
And the last video I'm going to show you is basically the symptoms for if you have an STD. It's not going to show any of those nasty pictures, you know, but it's just going to tell you the symptoms if you do have one. I can hear this video's pretty low too.
Excuse me.
Can y'all hear? If not, I just, okay. So basically, he just said that the STDs you can commonly get tested for is syphilis, chlamydia, gonorrhea, HPV, herpes, and HIV. For men, the symptoms include discharge from your penis, dark urine, loose light-colored stools, yellow eyes and skin, small blisters that turn into scabs on your genitalia, swollen glands, fever, body aches, or soft flesh-colored warts around the genital area, and there also can be more symptoms. For women, the symptoms are pain during sexual intercourse, vaginal discharge. If it doesn't look like your normal discharge, like maybe if it's yellow or green or something like that, you should get checked out. Swollen glands, also fever, body aches, warts around your genital area, swollen lymph nodes, and also more. It said that 1 in 4 people are now being reported to have an STD, and that, like I said before, there are 19 million cases of STDs every year. So, basically, a lot of people think that after you have sex, you could just take a shower and you think you could clean yourself out or whatever, douching, urinating, whatever you do after sex. A lot of people think things like that will prevent an STD, but things like douching, that makes it worse, because when you douche what you're douching into you pushes it further up in you, so that can make it worse. And also, if you don't like get your STDs cured, it could lead to further problems as stated in, I think it was the first or second video that I showed. Like, it can lead to infertility in women, it could lead to cancer, it could lead to, like, you can go blind, like, it leads to a lot of different things, especially if you're pregnant. It can be passed on to your baby. It's called complications for your child. And yeah, so I guess basically in conclusion, if you want to prevent STDs, the best thing to do is not have sex. But if you're going to have sex, limit your partners, use condoms, and get tested regularly. Thank you.